How many times have you coached a posterior pelvic tilt that only led to the patient being more confused and their back hurting? I get it. This motion is really common in the physical therapy world, but really challenging for patients to understand. That's why in this video, I want to walk you through my framework so that you can be successful every time that you coach a posterior pelvic tilt. So over the course of the years of coaching a posterior pelvic tilt, I've really stopped and asked myself, why is this so challenging for patients? Not necessarily why is the execution hard. I understand how it's tricky. They're not used to using these muscles in this type of way. But why is there zero compliance, right? Think about it. The last time you prescribed a posterior pelvic tilt, did your patient do it? A lot of times they don't. And that's what I really wanted to understand. And to me, what I think we miss when teaching a posterior pelvic tilt exercise is that we don't show the patient the value of understanding a posterior pelvic tilt. If it's just an exercise, I don't think it's going to be successful long term. Sure, they may do it a little bit, but if the patient doesn't see the value, they're never going to buy into it. So for example, if we're working with Mr. Jones who has low back pain, if we prescribe a dead bug, right, usually one of the most common posterior pelvic tilt exercises, if we tell Mr. Jones that, hey, we want to tuck our pelvis and do these things, we want to hold that and move our legs and do that 10 times and then move on, chances are slim that he's going to continue to really build that. Instead, what we want to do to provide value, or not even to provide value, but to show value, is that we need to tell Mr. Jones that, hey, you know how you've been dealing with back pain for 30, 40 years? Well, the back pain is the symptom. The position of your pelvis is the source. Your pelvis is in a position that's creating your abs to be weak. It's creating your back to be compressed. So what we need to do is really improve our mobility, stability, and strength of the pelvis. And once we do that, then we can start to get you out of pain permanently. And so this dead bug exercise is a way that we can do that only if you're really aware of controlling the pelvis position. So you can see how reframing it and educating it in that way is hopefully going to help Mr. Jones see the value, which is going to increase buy-in, right? Which is great. The more he's bought in, the more he's going to want to do it. But that's ultimately going to lead him getting better results and getting out of back pain long term. So the first step in my framework is changing the language. I feel that the language that we teach a pelvic tilt in is too anatomical and too confusing. So what I like to do is start people in a hook-lying position with the ball between the knees. This helps patients just start in a neutral pelvis, so they're not too externally rotated or too internally rotated, just neutralizes the pelvic position. So from here, I like to cue one hand on the belt buckle and one hand on the ribs. So what's going on here? Well, the hand on the belt buckle is what I like to cue the pelvic motion with. So instead of saying, hey, Mr. Jones, can you move into a posterior pelvic tilt? Or Mr. Jones, can you move your pelvis in a posterior direction? All we need to say is, hey, Mr. Jones, I need you to imagine that you have a big belt on. And that big belt has a big belt buckle. And I want you to move your pelvis, or this area, so your belt buckle goes towards your chin, right? So this hand is representing the belt buckle. So if the pelvis is turned this way, the belt buckle's towards the feet. If the hand goes this way, the belt buckle's towards the chin. This hand is monitoring the ribs. When we perform a correct posterior pelvic tilt, the rib cage should depress naturally. So a posterior direction is going to drop the rib cage, and anterior direction is going to flare or extend the rib cage. So now when we put them together, it's, hey, Mr. Jones, I want you to move your belt buckle towards your chin until you feel your rib cage drop. And then he'll monitor his hand position. We're here. Normally people will start to bridge. That's when we say without coming off the table, without lifting your feet, right? We're just trying to use these muscles, and then they'll start to get it, and then they go belt buckle towards their chin, and the rib cage comes down. Now, this can be a hard motion for our patients to execute. So if it's challenging, cue Mr. Jones to arch his back. I find that this works with pretty much everyone. Some people will get confused with the posterior direction or the posterior pelvic tilt. And if that's the case, just say, Mr. Jones, I understand that's a challenging motion. Can you arch your back? And typically they'll do this. Now, what is this? This is just an anterior pelvic tilt. Now, don't cue them the belt buckle from this position. Just say, okay, now do the opposite, right? So now go into the opposite, and they'll usually tuck, and we're waiting and they're waiting to feel the rib cage come down. So again, part one of the framework is changing our language and giving them new cues so that they're not confused and can start to really understand how to do a posterior pelvic tilt. So the second step in my framework is the awareness progression. So the main focus here is not necessarily on the performance side. How much are the abs burning? How hard are they working? It's more so, are they aware of the position that their pelvis is in? And so we can use a dead bug for a classic example here. So while I'm going through this, I'm going to cue Mr. Jones that, hey, Mr. Jones, I want to make sure that you never sacrifice this for this, right? We need to focus here. The legs are a distraction. I don't really care what you do with them. You can do whatever you want as long as you are controlling here. So that means if we're going down on the descending portion and we start to feel our pelvis lift, I need you to stop before that. So I don't care if you touch the table. I don't care if you go this much. I don't care if you go straight leg. You need to be aware that the pelvis is not losing the belt buckle towards the chin position. All right. So then we'll do the same thing. We'll put hand on the belt buckle, right? That helps them monitor the pelvis position. Hands on the ribs, because even if Mr. Jones loses the pelvis, the ribs are going to tell him, right? So if he can't feel that he loses it, the ribs are going to go up into extension. So it's an easy way to bulletproof them really understanding if they're maintaining the right position. So again, posterior pelvic tilt, the ribs should come down, belt buckle towards the chin. If we're doing a dead bug, again, I don't really care where they go. It's more the principle. And as they start going down, they're going to stop before they lose the pelvis. Make sure at this point they're really not holding their breath. If you want to sync it up to breathing, it'd be an inhale on the way up, exhale on the way down, right? Not losing the pelvis. But again, the second part of my framework is just getting them aware of their pelvis position as we add in distractions. So the final step in my three-part framework is the performance progression. Now, I'm about to show you an exercise here, but I just want to remind you that through this whole video, the big takeaway is not the exercises that I'm reviewing or choosing, it's the principles that are behind them, right? So just make sure you remember that as you go forward, and don't think you have to do these exercises. Do what's going to be best for your patient. So for this part of our framework, our patient should have awareness. Now we are trying to get them in a uncomfortable position, aka muscles burning, where they still have to maintain a good position. And the best way that I like to do that is with a foam roller press up, aka a plank on a foam roller. Now what the foam roller allows, because it's cylindrical, it really allows them to feel that posterior orientation, right? So from here, it's a pretty simple exercise. We're going to go on the quad, and you go into a traditional plank position. Make sure our hands aren't clasped. Make sure they are separated in a neutral position. And then we go through 4 steps. It's head down, chest up, belly button up, tuck the tailbone, aka belt buckle towards the chin. So notice how you can really see that posterior pelvic tilt happening. From here, we can work on breathing. We can work on lifting off if it's too easy. There's different ways you can go. But the point is we're trying to get to an ab burn where they're not losing their position and falling into extension like this, but can really hold on to the optimal position that we're looking for. So I hope you found my framework valuable and as a resource the next time you coach a posterior pelvic tilt. Now, before I let you go, I want to go over 3 quick points that are really important when coaching a posterior pelvic tilt. And the first is breathing. We want to make sure that patients aren't holding their breath. We need to see rib cage movement, specifically depressing when we go into that posterior direction. And if we're holding our breath, we're not going to achieve that. So sometimes you may need to cue the patient to exhale as they're going through their motion. Number 2 is overall movement. What you'll find is that depending on the starting pattern of the patient, you may need to go through more range of motion compared to others. The easiest example is those that are in an anterior pelvic tilt, right? If someone's in a higher amount of an anterior pelvic tilt, they're going to need to go through more range of motion. And you may be asking yourself, how do I coach this? I like to use a number scale. So if you think of 0 as doing absolutely nothing at rest and 10 being the most extreme posterior pelvic tilt, you may have to coach someone to go to their 5. You may have to coach someone to go to their 1. You may have to coach someone to go to their 3, right? What we're trying to get them in is more of a neutral position where we start to see the rib cage drop. And that rib cage dropping may come at different points for different people. So kind of remember that as you move forward. The last thing is really striving the value, like we really talked about through the whole video, that we never sacrifice the pelvis for the extremities. So as we're going through our specific exercises for the pelvis, we're aware of that, but make sure our patients understand that, hey, as you're squatting, you need to not dump into your pelvis and go into this anterior pelvic tilt. You need to be in control and aware of that, right? And never sacrifice the legs, aka a squat depth, for the pelvis, right? It's an easy example. So again, I hope you found this to be a valuable video. And if you want to take your learning further, I'd encourage you to check out our Performance Redefined course. This is our self-paced online course where we go into really getting into mastering our coaching, specifically mastering intentional and purposeful coaching so you can get better results for your patients. I will go ahead and leave that in the description below, and feel free to let me know if you have any questions, and I'll see you in the next video.